Dr. Mark Spellman.
Hi, Representative Wood. Nice to see you again.
Hello.
Senator Cabrera, Senator Huang, Representative Pavlak D'Amato. It seems that you are a starship captain from your setting. Um, I do apologize if I'm going to be preaching to the choir, but nonetheless, I'm Dr. Spellman, Mark Spellman. I'm a psychologist in private practice in New Fairfield and a member of the Legislative Committee of the Connecticut Psychological Association. I'm testifying on their behalf. We are in strong support of raised Bill 341 and 5377, but with a 12-month limit consistent with Senate Bill 341. These bills will greatly strengthen our confidence in payment security, increase access for mental health care for Connecticut citizens, and in the long run, save money for insurance companies because research shows that when people who need psychological care and mental health care don't get it, their medical bills are higher than if they do. Clawbacks are a big problem for Connecticut psychologists. A recent survey of ours showed that 68% of respondents have experienced clawbacks, and over half have received clawbacks for more than a year. So that 15-month to 12-month limit really is a big deal. Might not sound like it, but it really is. As you know, it's been difficult for us to navigate clawbacks. It's hard to appeal them. We rarely get a clear explanation for the reason for the clawback. These bills address those problems. They really help a lot. What happens due to clawbacks is eventually people who are driven by a sense of mission to stay in network and serve their neighbors and their communities at in-network rates get demoralized and we leave. Everybody loses. We're unable to fulfill our sense of mission. Connecticut residents are less able to get in-network mental health care. And again, medical insurance companies' costs go up in the long run. I would really like to advocate to my colleagues to continue to remain in network, to join panels, to serve people who have less resources than those who enjoy out-of-network benefits. It'll be a lot easier to do that with this bill. Please pass these bills with a 12-month limit. Please preserve access to care. Please help us continue to provide that care. And this isn't that unusual. Many of our neighboring states do have 12-month limits. Maine, New Hampshire, Massachusetts, Vermont, and Illinois all do. And it's not just us. Social workers are leaving networks too because of clawbacks. I've included all that in my written testimony. So thank you for hearing us out. And thank you so much for the support and access you've given Connecticut psychologists over the years. We dearly appreciate you.
Thank you, Dr. Spellman. We appreciate what you guys do, and you have my support on getting the clawback language over the finish line this year. As you know, we've been working with you and your organization for it seems like a really long time on this, so I'm very confident that this is the year we're going to get it done. I've actually seen this language appear in several other committees, so
Yes,
hopefully
it's very heartening.
I know they're finally listening to us. So thank you for your advocacy on that.
Thank you for being our friend.
Yes. Representative Pavlak Tomato.
Thank you. And I want to reiterate also what Chairman Wood said. And so you agree with the 12-month limit, though, as far as clawback was. Is there any change or in the language of any of the bills that you would like to see, or is most of it doable for you?
Thanks for the question. I mean, 12 months is fair, and fairness really helps us sustain our sense of mission. I understand that, sometimes computers need time to catch up with themselves. I had a clawback this year when patients changed insurance companies. I didn't realize it. They didn't realize it. They thought it was their secondary coverage. It became their primary. That clawback came in about 4 months later. That's fair. It's the ones that hit, more than a year later, the patient is gone. There's nobody to talk to about it. Those are what are killing us. I mean, we understand a fair period for a clawback. That's fine. And we don't want to support a limit on clawbacks for fraud or duplicate coverage. That's all fair. but we don't want to be exposed to the risk of you never know when suddenly $3,000 is disappearing out of your reimbursement that month that you were counting on for your mortgage or your kids' tuition.
Right. Yeah, I have to agree, especially accounting wise. I just can't imagine the nightmare that it creates. So I think that's fair as well, because I don't know how you go back, right? 3 years.
You can't. You can't.
Yeah.
That person couldn't have afforded out-of-pocket
Right.
therapy in the first place. So, we usually end up just eating it.
Yeah. So, well, thank you for your testimony. I appreciate that.
Thank you for your question.
All right, Dr. Spellman, it was great to see you. Have a wonderful day.